Dr. Scott, how objective and safe are clinical trials for ovarian cancers?
So this is an amazing question, and one that we often get as researchers when we approach patients for clinical trials, because we want to make sure that trials are safe. We want to make sure that if we enroll a patient into these trials, that there's going to be no undue harm to the patients. I often tell my patients, I think a lot of my colleagues and Dr. Lee would agree, we want to treat these patients like someone that's very near and dear to our hearts, a loved one, a sister, a wife, a mother. And so we want to make sure that there's safety involved with it. Clinical trials have been designed to have a lot of safety mechanisms involved with them. In order for a treatment or a drug to be even brought to a phase 1 trial, there's been a lot of investigational work that's done from a laboratory standpoint to make sure that we don't think that there's going to be undue harm when we bring it into the patient population. And then we safely monitor as we go along with each one of the phases of clinical trials that in fact it is a safe treatment and that there is no undue harm to it. These trials often have what we call data safety monitoring boards that are their sole purpose is to make sure that if there is any kind of adverse outcomes that are being seen in these trials, that we do something about them, including potentially shutting down a trial if we see that there's any undue harm being done to patients. And one thing I've often heard from my patients is, I don't want to be a guinea pig and I don't want to be experimented upon. I think it's important for us to realize is that these aren't trials where we're experimenting and expecting there to be undue harm to patients. We feel that these are very safe drugs and moving forward. Obviously, we don't have all the data on the drugs, or we don't have all the data on the treatments, and that's why we're doing these investigational trials. But we feel relatively that they're safe going forward. And as these data safety monitoring boards, as the local institutional relation, the IRBs are involved, and it's also as the researchers ourselves, the local researchers like Dr. Lee and myself are taking care of patients, we're monitoring very closely with the patients that there's nothing that seems to be abnormal or going wrong with these trials. And if there is, then obviously we want to make sure that we do our best to stop those trials immediately and take away any adverse effects that could be happening and to treat them.